Okay, let's start with the first topic. Let's call on CA, Ma'am Mildred. Good afternoon po, Ma'am Mildred.
Magandang hapon po sa lahat. Magandang hapon po mga classmate. Yan, ang ganda po ng topic ngayon kasi Heart Month. Kaya ang ating paksa ay ang tungkol sa heart. Heart function. Malapit ng Valentine.
Nagkataon, no?
Opo. Sana natapat pala, Dok, sa February 14 na, no? Martes. Okay. Function of the heart. O yung sa Chinese term ay Yin. So, pangunahing function niya ay governs the blood and control the vessels. So, yung ano natin, yung heart, talagang nag-govern siya sa sa ating blood. Naalala ko, Dok, yung meron po ako naging pasyenteng may problema siya sa sa puso. Pagtapos niya mag-palpitate, dumudugo yung ilong. So, ibig sabihin po, hindi nakokontrol ng vessel yung blood, kaya talagang lalabas.
Madaming heat.
Opo. Tapos, siyempre yung govern na function ng heart is yang. At yung pag-house naman sa spirit is yin. Yan. So yung spirit sa ating heart, ang tawag natin ay shen. So kung hindi na-house ang shen, may problema ang function ng heart. Kaya mamaya po makikita natin ang mga problem pag hindi na nag-house ang shen. Yung heart din ang opens the tongue. Kaya parang may kasabihan po, di ba, na ang lumalabas sa bibig, sa dila mo, syempre salitang lumalabas sa dila natin, ay galing sa puso. Kasabihan po yun matatanda, di ba? Talagang connected yung tongue sa heart. Yan. Manifest in the facial complexion. So nakikita din natin yung situation ng heart pag nakita natin yung ng mukha. Mamaya mas madidiscuss pa po natin anong nangyayari. Emotion of the heart is desire and joy. Okay, palalilimin na po natin mamaya yan. So, heart is govern blood and controls vessel. Heart is responsible for circulating blood throughout the body. It depends on lung qi for this function. Kasi alam naman natin na yung heart ay siya nag-govern sa blood at si lung ang nag-govern sa qi. So kung may problema si heart, magkakaroon din ng problem si lungs.
So ibig sabihin, Ma'am Mildred, if the lungs are weak, hindi ito magagawa ng heart, no?
Yes po.
Kaya pala yung mga taong malalamig yung kamay, example, meron kang let's say first patient mo. Oo. So yung pala yun. And usually we associate na pag malamig yung kamay, mahina ang lung qi. Yung
Yes
pala, for the heart to perform its function of circulating blood throughout the body, so this time, kulang yung circulation sa extremities. It's because mahina po ang lung qi. So even if your heart is okay, but you have poor lung qi, ganun din po yun. So it doesn't necessarily mean pag malamig yung kamay mo, mahina yung heart. It's because nakadepende po ang heart sa lung qi. Okay? So those people with very weak wei qi, weak immune system, they have cold hands, right? Hello, Ma'am Mildred? Nawala yata yung audio nyo. Ma'am Mildred? Hello? Ma'am Mildred, are you okay? Okay, I'm afraid Ma'am Mildred has lost her connection. Ma'am Mildred? Oh, she's trying to get in. Okay,
Nawala.
Okay, sige po.
Ako lang nawala kasi yung laptop ang nawala. Okay po. So, nawala ang aking laptop, cellphone po ang gagamitin ko muna. So, governs blood and controls. Nasaan ka na po, Doc? Lung
Na.
chi, heart blood. Yung kanina pong dinidiscuss mo, Doc.
Mm-mm.
Lung chi needs heart blood to nourish chi. Naku po, ang liit nito. Kailangan buksan ko yung isa pong... Doc, ikaw muna, Doc. Hahanapin ko muna
Okay,
yung
ganito.
nakaano kasi.
So ito yung tinatawag nating give and take. Parang it's a harmonious relationship. So earlier we were mentioning that for the heart to perform its function, kailangan po niya ang lung qi. Okay? And this time, the lungs naman, the lung qi would also need heart blood for nourishment. So we can say that lung and heart will have a harmonious, you need to maintain a harmonious balance to guarantee regular heartbeat. Okay? So that is why yung mga taong medyo may, issues sa heartbeat, sa heart rhythm, we will always look at the lungs, not only the heart, but also the lungs. Okay, so I hope that's clear. So this is a give and take relationship. So if the heart chi is strong, the vessels are healthy because what? Because the heart is good, no? And the pulse is regular and in harmony. Hindi siya irregular yung ano. So you should be able to perform this on all patients, especially when assessing the patient for the first time. No? So a patient who comes in with, malamig yung kamay, siguro naman nilalamanan yung mga pasyente nyo, no? Will always tell us that we need to really look at the lung qi. And if you have a lung issue, you can probably also have heart issue and vice versa. And the heart, this is also very important when it comes to mental activity, when it comes to good sleep, no? The heart kasi houses the spirit. So we can say that the heart is the seat of consciousness and mental activity. So what happens if you have very deficient heart yin? So it will not provide a house or a residence for the spirit. That is why some people are restless and some people may have, not so good memory. Okay? Or medyo may konting problema sa mental health. Okay? So when you say heart housing the spirit, this means that the heart is the seat of consciousness and mental activity. So that means you know what you're doing. What comes out of your mouth is an indication that you are conscious. Okay? And the heart depends on the supply of sufficient yin and yang to give the spirit a surrounding in which it can flourish. So if you happen to have heart yin deficiency, no, lalo na pag mainit yung pakiramdam mo sa gabi, di ba, you can hardly sleep, right? You can sleep, but you keep on waking up, di ba? So lalo na pag if you have heart blood deficiency, usually it would start with heart blood deficiency, then heart yin deficiency. If you have heart blood deficiency, you find it difficult to really get to sleep. Okay? Yun. Because pag nag-aggravate yun, hindi mo pa rin na-correct, hindi mo na-address yung issue, hindi mo alam na pwede mo palang gamitin yung heart 5, heart 6. Okay? Kaya for those people who are having issues with sleep, I would suggest you would presume na medyo meron ka ng heart deficiency because probably you can no longer do the things that you could normally do, right? Parang everything now is with an effort. So you might want to look at your heart pulse, okay? So the heart
Yes po.
says, yeah. Can you continue, Ma'am Mildred?
Yes, Doc. So, yung hearts possess abundant yang but little yin. Kasi 'di ba nasa fire nga siya, kaya talaga abundant ang kanyang yang. So that is especially susceptible to yin deficiency. So mas nagdi-deficient ang heart sa yin. So yun nga po yung sinabi ni Doc kanina na 'pag may heart yin deficiency tayo, inability of heart yin to house the shen. Kaya
Yeah.
yun magkakaroon ng insomnia,
Oh.
restlessness, anxiety.
Kaya ang tawag po sa heart channel is Shao Yin, lesser yin. Ang kapartner niya dito po is the kidney. Remember? Fire, let's look at fire as something that is yang, something that is alive. So, ibig sabihin, it has more fire, it has more yang than yin. So, since kukunti lang yung yin niya, there is always a tendency na magkakaroon tayo ng yin deficiency. And what happens? You have night sweats. And this will be explained by Ma'am Mildred.
Tapos 'pag nag-heart yin deficiency po tayo, siyempre yung blood flow become fast and erratic. Kaya po yun nagkakaroon tayo ng minsan palpitation bukod dun sa na-night sweat tayo.
Actually, the yin, which actually consists of the blood and the body fluids, will actually be the residence of the shen, the spirit, no? So can you imagine, ang shen mo, wala po siyang house, wala po siyang bahay. So what will happen? Your spirit becomes restless. Okay?
Kaya yung lumilipad yung Doc, yung hindi na
Kasi
makatulog.
hindi lang yung yin, heart yin.
Opo.
Bakit? Kasi sobra yung yang eh. Diba? So yung mga taong, I'm sure you've seen people who are so like, mabilis, yung parang masyadong aligaga, no? These are the people who really panic, easily panic, very anxious, yung mga ganun. Yes. In fact,
Madaling mataranta.
oo. Kasi sobra yung yang, kukunti yung yin. And take note, if you have yin deficiency, eventually you'll have heat, right? Empty heat. So, at saka pag kulang ka ng yin, kulang ka ng blood, your spirit becomes restless kasi po wala pong dwelling, walang residence yung ating shen.
Kasi nasa blood siya nag-house.
Yeah.
Ayun. So, blood is root of the spirit. Ayun po yung sinasabi ni Doc kanina. It surround and anchor the spirit, so the spirit is at peace and can be happy. So kung okay yung blood ng ating heart, yung spirit natin nandoon. Kaya kung kulang, ayun makakaramdam na tayo nung sinabi kanina na restlessness, parang natataranta ka, hindi at ease ka. So makikita natin sa pasyente kung gano'n yung attitude.
Yeah,
Alam na natin.
may nag-message lang sa akin, pero ayoko sabihin sino, no, na nakaka-relate siya. Siguro malamig yung kamay niya. Okay, so at saka pinapawisan, ganun po yun, no? So I hope everybody is clear at this point. O talagang malamig daw. O, di ba? Para tayong manguupo.
Yes
Okay.
po.
So, root of the spirit. Remember, blood is yin, no? How do you call this? You make sure that you have enough heart blood. Make sure that your heart pulse is really, you can palpate it. Sa middle level, okay? Yon. So, yun po.
So yun. Pag heart blood deficiency tayo, cause the spirit to restless, it lead to depression. So magkakaroon tayo ng depression, tapos fear, yun sobrang yung excessive dreaming. Minsan nagtataka na tayo, ba't hindi na ako nakatulog, lagi na lang akong nananaginip kasi nga hindi nahahouse yung shen eh. Yun, tapos magkakaroon ka ng insomnia dahil kulang ka na ng blood.
Yeah, definitely. Kasi 'di ba, heart blood deficiency, you will always have an issue with the kidney. Kaya nagkakaroon ka ng fear, madali kang magpanic, yung mga ganon. And you also end up being depressed because when you have heart blood deficiency, you will eventually have lung qi deficiency or heart qi deficiency. Diba? Ganun lang yon. Because lungs and heart, they belong to one. They belong to the upper burner. They're together. And excessive dreaming is, I would look at it as parang already affecting the liver. No? Kasi nga, di ba, medyo kulang talaga. And when you talk about dreaming, you'll be talking about the hun, And we know that the liver and the heart, they have a mother-son relationship, right? Wood and fire.
Tapos
Insomnia, yeah, that's a given because insomnia is a sign that the spirit is wandering. It's very restless kasi nga kulang po ng yin, kulang ng blood.
Yes po. So yung relation niya sa liver, pag konti yung ni-store ni liver, sa siyang cycle, konti yung dadali niya kay heart para i-circulate.
So,
Yeah.
yung mga nakaka-relate dyan, you know what to do. O
Yung
tinan mo,
aming
unrest,
Dok.
restlessness, depression. Siyempre mahina yung lung chi, di ba? Affected yung lungs. And the heart and lungs, they always they belong to the upper burner, both of them.
Relate na relate, Doc.
Ay, wow, thank you for being honest. Yung isa, ayaw ko mabanggit, okay lang, pero halata naman.
Hindi yung emotional problem.
I hope everybody
Yan.
will ask questions. I really like this topic. You know, ang dami pong ganyan. Sa totoo lang, saan ko ba nakinig yung news? Dapat daw nga ang gobyerno ngayon will exert a lot of effort in learning how to deal with yung depression. Kasi pag depressed ka, pwede kang magpakamatay. So ngayon, alam nyo na. Tanungin nyo si Ma'am Mildred.
Pero talaga, Doc, ang dami pong case ngayon ng lalo pa sa mga sa teenager. Marami pong case ng nagpapakamatay. Mga nag-aaral po, kahit dito sa amin meron. So yun, malaki ang yung heart, yung shen. Malaki yung relationship.
Can I share also? Marami
Yes po.
pong nagpapakamatay at saka marami ring nabubuntis. Bakit gano'n? Sumobra naman yata ang niya.
O dahil you
Sa
know,
mga teenager, daming nabubuntis.
kasi nga, they need, di ba, they need intimacy. And some people will pretend na parang sila yung security blanket, yung pala nag-take advantage na. Yun. Anong lang yun eh. Saka
Dahil
maybe,
malaking effect din po siguro, Doc, yung pinagdaanan nating pandemya. Parang,
Pandemya, oo.
totoo yan.
Oo.
Siyempre,
Parang nabigla sila.
hindi natin alam saan kukuha ng pera. Diba?
Tapos,
Tingnan nyo if you're depressed,
hindi-
emotional problem, this will give you heart blood deficiency. That is why if you have this depression thing, you cannot sleep. Okay? Heart blood deficiency. It would take like 2-3 hours before you get to sleep. Minsan i-imagine mo lang natulog ka na eh. Okay, I hope
may thinking na apektuhan po talaga.
oo, parang napatigil kayo lahat.
Oo.
O, tingnan nyo,
Nawala.
Oo naman po eh.
At saka, you know what will happen? Heart blood deficiency. Yung heart is the mother of the spleen. So, nakadepende rin yung spleen sa blood. Maghihina ang spleen. Magtatabaan tayo. You know? Saka yung mga dila natin lumalaki. Parang bumibilog. O, sino yung mga bilog na yung dila dyan? That is a sign. Kailangan nyo na mag-attend ng lecture on depression or anxiety. Continue, Ma'am Mildred.
Health of the is reflected in face. Facial complexion depends on the state of chi and blood. Kasi nga, kung kulang ka ng chi, kung kulang ka ng blood, yan, makikita talaga. Pag blood deficiency, magpipale. Pag chi deficiency, pale din. So, pagtingin pa lang natin sa pasyente, makikita na natin anong problema.
At saka may share lang ako bago ko makalimutan. I have kasi one patient. Actually, nag-work sa spa. I was a bit worried. She was only 34, 35. And, assessment ko, mahina talaga yung heart. Alam mo kasi sa babae, marami kang makikita sa right ear. Okay? Alam nyo, kinumpare ko yung right ear sa left ear. Di ba, pagbalik niya, ko ulit. Iba yung kulay ng right ear. Maputla kesa sa left ear. Weird, di ba? Then, she had very high blood pressure, okay, because of the dampness, and probably it led to, an impact on the liver. Ganon. Kasi when you have dampness, then lalo na pag nag-phlegm na siya, this can impact your circulation eh. So it would be very hard for the blood, for the heart to pump. Okay? So yung mga ganon. Ay nako, don't worry. I'll show you. I'll find time. But nakita ko siya.
Yan. So if there is enough blood and if the heart is strong, the face is rosy and shines. Kasi nga kung maayos yung circulation ng blood, yung complexion talaga ay nagiging rosy at saka lustrous. Tsaka full of vitality. Kaya
Yeah.
kahit hindi sila naglagay ng mga pampaganda,
Saka iba
Ikita mo
talaga
yung
ang kulay ng mga taong may heart blood deficiency.
yes po. Pale complexion is a sign of Chi deficiency or blood deficiency. Ayan, mga parang malungkot, mga mukha, maputla. Blood stagnation manifest in bluish violet facial complexion. Kahit hindi naman sila sinuntok, pero parang may makikita kang ganyan, na may bluish. So, nag-stagnate yung blood, kaya nagkakaroon ng bluish color. Hindi siya nag-circulate ng maayos. Red facial complexion is a sign of heat or heart fire. Ito pong heart fire na to, ay naalala ko, Doc, kasi yung heart natin protected from the external heat, pericardium ang nagpo-protect. Halimbawa, nagpainit tayo, di ba? Pag nagpainit tayo, para hindi direct na iinit yung heart, i-absorb ni pericardium. Pag direct, yung small intestine naman, siya ang nagpo-protect from internal heat. Halimbawa, yung nagagalit tayo, ang gagawin ni small intestine, i-absorb niya para hindi masyadong mag-hit si heart, yun ang role niya eh. Pero gagawin ni small intestine, ipapasa niya yan sa urinary bladder. Kaya minsan nagkakaroon ng yung umiihipon ng dugo pag sobrang init yung puso.
Mm-hmm.
Akala mo kidney lang yung may problem. Kasi minsan kahit tinreat mo na yung kidney, yung urinary bladder, pero ulit-ulit, ayun, dapat talaga tingnan yung heart. Kasi doon ang gagaling yung init na ina-absorb ni small intestine, ipapasa niya sa urinary bladder. Nagkaroon na po akong pasyenteng ganun.
Yeah. Kailangan if you're looking at heart as the cause, then you would always ask for palpitations. No? Yung na-feel niya parang, nararamdaman niya yung heartbeat niya.
So sabi nga dito, dapat may further examination para mahanap natin. Yun.
True.
Pero minsan naman, Doc, dyan sa Baguio, sa Mambina, marami dyan ng ganito ang kulay ng mukha eh. Dahil ba sa mataas yung yung place, tapos malamig, talagang kailangan yung blood nila, na yung heart, marami po dyan kasi nasa 140 ang parang regular BP nila eh. Nung nandiyan po kami, nung nagbi-BP kami. Pero ang explanation naman daw nun dahil nga malamig, parang yung heart, kailangang mag-pump sila para ma-heat yung body.
Pero alam mo, may na-meet ako doon when I was there. Qigong practitioner siya. In fact, yung mga time na meron pa, ewan ko kung alam ni Ma'am Vina to, meron silang sa Burnham Park, may Qigong. Libre lang yata yon. So I was curious. When I met the teacher, nagulat ako, ang lamig-lamig sa yung kamay niya mainit. Sabi niya, wow, how did you do that? Sabi ko, how did you do that? Ito na yung nagagawa ng Qigong. Kaya if everybody knows how to do Qigong, siguro, pwede tayong mag-adjust sa weather.
Opo, yung flow talaga nung body natin naaayos yung exercise.
So most likely po, hello?
Sige po.
Yes po.
So most likely pag ang environment po is malamig, karamihan ng mga tao doon ay nasa mataas ang high blood pressure. Kasi nagkakaroon ng stagnation outside, nagkakaroon ng stagnation kasi cold nga siya.
Totoo. Pero kailangan marunong silang, kasi eventually masasanay sila eh.
Yeah, so.
Pero they have to do something na. Yun nga lang.
Parang ginawa 40 doon.
Kasi di ba pag malamig, you don't tend to move at all. So yun ang kakaroon ka ng dampness, phlegm, and this will lead to high blood pressure.
Yes po.
Kaya siguro ubo ng ubo
So,
si
Yes.
Gina. Ay, joke.
Mm-mm.
Si Ma'am V. Sige.
napapasok ng
Noted
cold.
po. Noted po.
Okay po. So, yung health of the spirit. Sige, Doc, may sabihin ka pa po.
Wala na po.
Wala na po.
Okay. Health of the spirit is reflected in the eyes. 'Di ba? Kaya nga minsan pag titingnan mo yung tao, pag tiningnan mo pa lang sa mata, parang nakikilala mo na siya eh. Kasi andun daw yung spirit sa mata. Pale, dull eyes show a disturbance of the spirit. So yan, makikita mo rin yung minsan yung mga taong parang may siyang problem, umiikot-ikot yung ano na yan eh. Umiikot yung mata, makikita mo kung normal siya o hindi. 'Di ba, Doc? May ganun po kayo bang karanasan?
Totoo pala talaga yung the eye is the window of the spirit.
Yeah.
Wow.
Yes. At saka
Iridology.
actually tingnan niyo rin yung root of the tongue. Yung
Red.
Sa
Red
heart.
is that.
Sa dulo.
So, opo. So heart governs the tongue, including color,
Tip.
form, and look of the tongue, particularly the tip. Kasi 'di ba yung tip nga yung ano ng heart. Ito tulad ng picture na to, meron siyang heat in the heart. Ako Doc, yung isa kong pasyente, hindi ko pa masyado na-interview pero nakita ko talaga yung ano niya. Nung pinapaano ko po yung tongue, hindi niya mai-twist, hindi niya mapapunta doon para makita ko yung likod. Matigas yung dila niya, tapos nung tinignan ko, yung line po hanggang doon sa dulo niya. Hanggang doon sa dulo. Kaya hindi siya masyado pa umiimik, pero pag nagsalita siya, putol-putol na po. Kaya sabi ko talaga matindi yung ano ng heart.
Oo nga. I agree.
Okay. When the heart is healthy, the sense of taste is normal. Kasi 'di ba yung ano nakakaramdam tayo parang kasi yung taste ng heart ay yung bitter. Nasa liver din yung bitter pero sabi natin yung bitter naman kung paggising mo mapait pero kung maghapon na mapait yung panlasa mo na heart na yun may problem. So, the tongue can move normally and speech is clear. Kaya yung mga nag-uutal-utal, heart po yan ang problem talaga. Yung minsan nagsasalita sila parang tataling ko hindi niya nababanggit lahat ng word. Okay. Disturbance of the heart can manifest as aphasia. Aphasia ito yung parang nagsasalitang walang saysay.
Hindi.
Diba,
Hindi niya masabi yung gusto niya sabihin.
Yung parang hindi
Hirapan
bulong
siyang
sasabihin
sabihin yung
niya.
gusto niyang sabihin. Hindi niya
Yes,
ma-express.
So, tremor of the tongue, nakakaroon ng tremor. Pero pag may tremor, may wind din po ito, Doc?
Yeah.
Is impeded. Impeded speech, yung mabagal po siyang magsalita. Dahil nahihirapan yung...
nabubulol. Parang
Nabubulol.
hindi yung gano'n. Ko parang
So, basta may...
Hindi ba sign din yun ng aneurysm?
Yeah, the right word aneurysm.
Actually, if you have aneurysm, you blame it on the heart because when you talk about aneurysm, you're actually referring to blood, a very weakened artery in the brain. So, ibig sabihin, the heart is not exerting its control over the blood.
Affected din.
Kaya siguro, if we observe na yung parang nahirapan na magsalita. So, dapat magpa-check na sa cardiologist or neurologist.
But hindi nagsasalita.
Saka sa kalaman natin nalalaman ng pag nag-rupture na, ruptured aneurysm. Diba?
Kaya nga po.
So, pag medyo may na tayo sa speech, kaagad? Investigate.
Relax. I think, Doc, when you experience that, you must be relaxed. Hindi yung mas natataranta ka pa. Minsan kasi yung mga nag-care sa'yo, yung pa natataranta, kaya pati ikaw natataranta.
Alam mo, oo, yun nga And iba kasi pag andun ka na Diba, hindi mo na rin alam yung gagawin. Di ba, mabe-blame sarili.
Pero I had an experience. I had that kind of experience. Parang ano, hindi ka nabubulol ka. Parang
Yeah.
tongue twisted ka po.
Mhm, mhm.
Tapos ano, I just kasi before I had what you call, ay naisip ko lang na sabi sa akin ng lola ko na whenever in any case, just be quiet, just be relaxed. Tapos
True.
nawala din po na
Mm.
I was able to pass that experience.
Mm.
Pero parang dapat aneurysm na yun eh. Pero
Mm.
nagawan ko po ng paraan. Kailangan lang siguro talaga ang mga turuan
Al-
sila na hindi sila mataranta.
Oo. Alam mo kasi ganito yan. When you have aneurysm, hindi mo nararamdaman yan unless nag-rupture eh. So let's all presume na kasi bakit nag-rupture? Kasi grabe yung surge ng blood flow, no? Super heat, super stress kasi yung tao. Lalo na pag kulang tulog. Lalo na pag nakalimutan mo tao ka lang pala, no? So I think you know what happened about, those people that we know, celebrities din, na nagka-aneurysm.
I just thought about it na it's just a kind of mild stroke that I had. I had twice
Okay.
experience like that. Kasi na-feel ko na yung saliva ko on my left mouth na tumutulo na siya ng
Uncontrolled.
pusa eh.
Oo.
Yeah. So na-feel ko lang na imagine I had that one is about 20 years ago and recently lang itong siguro mga December something like that. Na feel ko yon na para bang ano talagang wala yung isip mo tapos I'm talking iba na yung sinasabi ko pero nag-relax lang ako tapos you know what I did lang yung ninidal ko lang yung LI4 at saka yung liver 3
Nawala.
tapos na-relax ako ang bilis talaga tapos yung ano Shenmen na
Ay,
pinag-usapan po
yeah.
natin doon
Yes, yeah.
ang galing talaga
Galing.
wala
Pressure
akong
mo ba?
ano
Kahit,
Needle mo rin.
Needle
ginawa
po,
kahit
ko yung
needle po yun.
acupressure lang, pwede na.
yung chopstick
Ako pressure. Okay.
ang opo acupressure yung chopstick tinusok ano winork out ko lang dito sa aking Shenmen. Yun, nakaligtas ako. Hindi na ako nagpa-check up. I didn't go to the medical doctor.
Okay na po ang tang ni ma'am. So may
Okay
mo
na,
yung tang.
Kaya nga,
ginamitan
ano,
ko na lang ng mga TCM. Magaling talaga ang TCM.
alam
Talagang
niyo,
I really vouch for it.
yeah, and at the same
Me too,
time,
me too.
kahit wala tayong nararamdaman, we should make it a habit to see an acupuncturist at least once a month or twice a month. No, let's start promoting. Kasi
Totoo po, totoo.
dapat ganun eh. You
Yes.
should have good sleep. People kasi they would look at acupuncture as something na medyo parang last resort na, let's face it. But what we're trying to do now is we educate people on how to examine their tongues. Kasi we brush our teeth every day, di ba? So, di ba tumitingin ka sa salamin habang nagbabrush? Ito yung
Yes.
tila mo.
And besides oral hygiene, that is where a lot of
True.
bacteria is
Yeah.
coming from. And so much internal problem, that can come in. Di ba sabi nga po nila, I'm sorry to tell this, mas malinis pa raw yung anus natin kaysa sa mouth.
Oo nga.
Kasi lahat na-absorb ng mouth eh.
Oo nga.
Totoo po
Tama.
ba? Thank you.
Thank
Well
you.
said po.
Sige. Parang iba yung mga tawa ng iba, no? Parang nakaka-relate lahat. Okay.
Opo.
Yes. Too
Sige.
much.
Ako, naka-first stroke, mild stroke na rin ako 2010. So, nakaka-relate po talaga.
Yung Shenmen din ma'am, alam mo po pag makakalimutin ka, halimbawa minsan di ba nagsasalita ka, hindi mo na alam yung sasabihin mo or may bagay na nalilimutan mo, i-pressure mo po yan. bumabalik. Kasi minsan, di ba yung ginagawa natin, pag may nakalimutan, babalik ka sa place para maalala mo kung ano. Pero ako po, pinipressure ko. Pag pinipressure ko, naalala ko
Yan
na.
na. Totoo. And then, ang isa pa ang na-discover ko na kapag yung shenmen, yung sa mata, kasi syempre, I'm not young anymore, mas i-workout mo, unti-unti, nagiging okay yung paningin mo. Hindi na
Totoo
ganun
yan.
kalabo.
True. Kasi may connection sa mata yung 'di ba? Sa likod ng mata natin, sa retina. Meron tayong central retinal artery.
Can I have some
Kaya
question?
Yes, please.
Regarding po sa stroke, lalo kapag may mild stroke, na gumaling. And then, may possibility ba to na yung sinasabi nga ng humors kapag may mild stroke ka na o nag-stroke ka na gumaling, hindi mo siya nabantayan, pwede ba itong mag-end na mild stroke ulit o may stroke ulit?
It happened to me na nagka-second mild
Yeah.
stroke ako. Pero at
Yung parang-
least alam ko na kung anong gagawin ko. Yun
Mm.
lang, yun mga
Kung hindi mo
operation.
alam yung gagawin, the second stroke would be more alarming. It could even be more fatal.
Alarmist.
Oo.
Baka dangerous na.
Yeah.
Ingat na lang,
Oo.
ingat.
So, ibig sabihin po, pag nagkaroon na po nito, talagang may tendency ulit maulit yung stroke at saka mild stroke, no?
Yes, pag hindi ka nag-aral ng
Depende sa-
acupuncture.
Yeah.
Ayun.
Hindi po
I like it. I like it, though.
Ang galing ah.
I like
Pero,
it. I like it so
Joke
much.
lang. Hindi kasi we need to be aware. We need to know what is happening.
Well, that's true naman po, Doc. Ito naman po yun eh. Kapag walang alam, oo. Pero kung wala po talagang alam na first remedy o first hand, talagang matutuluyan po yung pasyente o yung tao.
Oo, totoo.
Compare
Anyway.
mo po yung nyo, tenga nyo sa right and left, no? Sa mga lalaki, priority mo yung left. I-compare mo sa right. Pag magkaiba yung itsura, lalo na yung kulay, lalo na pag yung heart.
Hey, Doc Hector, can I ask a question?
Yes, please.
Yes po.
Yes po.
Yes, please.
Kasi na-question ko na ito kay tumigil lang po ako saglit. Na-question ko na to kay Doc Webster. Lane, kanina kasi nabanggit niyo yung aneurysm. So would it be possible na yung aneurysm ay babalik sa normal because of acupuncture?
No.
Okay. So i-control talaga natin doon is blood pressure.
Alam nyo, ang risk naman ng aneurysm is the rupture eh.
Mm.
When you have aneurysm, there is a weakened wall of the artery. So there's a part of in the artery that's weak. Kaya you should always be wary of stress or
Yeah.
Okay.
kasi talagang pag ibig sabihin kailangan hindi ka on fire. Hindi mo parang, di ba nakita niyo iba, namumula ka agad yung mukha?
Liver.
Yeah, liver. Starts with the liver.
Sige, Doc. Thank you, Doc.
Thank you rin.
Kaya napakahalaga din po yung yung pagtuturo natin sa pasyente nung pagbasa sa dila nila. Kasi may pasyente din po akong ganyan. Hindi umiinom ng gamot na nireseta sa kanya. Nung tinignan ko po yung grabe yung purple color dun sa heart. Tapos 140/110 ang BP. Ayaw niya magpa-gamot. Sabi ko, sige, bantayan mo na lang yung dila mo. Dapat hindi ganyan ang kulay ng dila. So nag-exercise po siya. Yung diet niya, binago niya. At least ngayon, okay na po yung weight niya. Nababawasan daw yung purple na color. Sabi ko, dapat mawala yan.
Turuan mo siya magwasya.
Awin.
Igwasya niya yung sarili niya. Meron tayo sa
Yes po, tinuruan ko po
kay
yung gano'n. Sabi ko,
Gwasya for hypertension. Anybody can buy it.
natakot din yung kasama niya, Doc. Pinaalis siya. Sabi niya, ay, umalis ka sa akin kung di ka magpapagamot. Baka bigla kang ma-stroke sa akin.
May area dyan sa atin, sa may groove, hypertension groove, sa likod ng ear natin. Keep on, lalo na pag nahihilo-hilo ka na, feeling mo parang ataking ka.
Massage the ear.
Yeah, the hypertension groove. For more details, check our ear acupuncture lecture on the channel.
YouTube.
Amen.
Uy, ayun mga
Yeah.
topics ko doon, ano yun ha? Talagang
Sa
importante.
FB, sa
Go
FB po
yan.
nga ako sa FB pa nga po ako natututo eh.
Oo, so kailangan basahin nyo
Ganda.
yun. Alam nyo ba, ang isa sa pinakamaraming views na ano ko is the scalp acupuncture for stroke. Kasi parang everybody, like, kaya nga na ano tayo we're lucky merong EA, electroacupuncture. I think everyone should have that. Kasi ang hirap-hirap kaya mag-twirl-twirl sa scalp.
Yeah.
Yeah, okay. Let's continue,
Okay.
Ma'am Mildred.
Hindi naman tayo ganito. Continuous talking is disturbance in the heart.
Parang hindi tayo
Salit-
tumitigil magsalita,
salita,
no?
walang tigil. Pero Ate Ana, ano, di ba? Ay, Ma'am Ana, yung mga nanay ganito.
Ay, naku, may kilala akong ganyan. Tinan ko muna kung andito siya, ha?
Sinabi mo pa.
May kilala akong ganyan. Ayaw talaga niya tumigil paulit-ulit. Ay, wala siya pala, nasa ano. Ay, joke lang. Oo, wala. When I met him, wow, sabi ko, yung pwede niyang sabihin in 3 minutes, paulit-ulit niyang sinabi for 2 hours. Grabe, I won't tell you who, but you know.
Yun na nga.
Sa kanyang heart para tumigil.
Ayaw niya talaga tumigil. Siyempre, out of
Parang
respect
nakakarinig
naman.
tayo, Ma'am Ana, no?
Ha? Ulit-ulit talaga, nabingi na ako. Kapag
Oh my God.
pag mag-request ka mag-pray before kumain, naku, gugutumin ka. Ang haba-haba ng prayer niya. Hindi naman sa pero wow, it's just
Yung
too
may
much.
mga toring-garing.
Kaya nga
Ay,
kailangan
grabe.
siya pag nagkita kami talaga ayusin ko yung
Pero pag kuhiran pa naman, hindi pa naman heart yun, baka talagang maano lang siya. Kasi kung iba-iba na, yung
Makwento
sinasabi,
lang.
mas,
Oh,
pero
ito,
kung okay
next.
pa naman po. Pero nagsimula na po nag-hit yata ang heart noon.
Oh, sige, tignan ito.
So, emotion is desire and joy. Strong and excessive emotion, anger or jealousy can lead to hit and damage the heart. Experience of the emotion takes place in the thorax. Kasi 'di ba, yung thorax, yung chest, pag hindi maayos yung flow ng chi at saka blood, ay talagang sasakit 'yan.
Ang kontra
Diba?
talaga natin heat.
Galit na galit.
Kasi pag may heat, mabilis yung daloy ng mabilis umakyat yung dugo. So if you have aneurysm, pwede siya mag-rupture. O jealousy, di ba?
Ay, nakasmile naman yung pinagjejelosan niya. yung babae ang inis na inis. So, causes the pulse to increase and the blood pressure to rise. Mamaya pupukpukin na niya yung katabi niya. Okay. Desires lead to heat and damage the heart. Siya yan yung sinasabing nag-iinit. Ano, Doc? Desire is the absence of tranquility and peace. Kasi nag-iinit ka nga eh. Kaya at ease ka dyan.
Kaya nga, kung may nakaka-relate dito, kailangan mo ayusin yung heart.
Maraming ganyan.
Dapat pindutin na agad, Doc, yung heart pag nag-iinit.
Tawag sa ganyan.
Ay, turo natin yung Valentine, baka maraming pag-iinit. Okay.
Okay na po?
Hello po.
So pag meron tayong desire, wala po tayong tranquility and peace. Ano na nangyari sa ating, okay, tuloy ko na lang ha. Now, so being under time pressure can easily give rise to excessive emotion. Yeah.
Namamarila, no? Example yan eh. Red traffic light can reason enough to cause an excessive emotion. Nagagalit. Sobrang nagagalit na siya, naiinis. Diba dyan sa Manila po, maraming nangyayari. Bababa tapos mamamaril. Which turn raises the pulse rate and the blood pressure. Ataas na. So pa maganda isang topic, Doc eh. I want is the root of desire. We all want to have a certain desire satisfied. Example, buying a new car or to be successful in business. Pag ang I want ay hindi naabot, Doc, anong nangyari?
Heart attack.
Heart attack.
Kaya nga, kapag ka...
Pera lang naman katapat niyan eh. Kung I want,
Exactly.
oo. So kung ano, bilhin mo na ng cash. Kung di mo kaya bayaran ng cash, di wag ka na lang bumili.
Kaya
Dok,
nga
paano
po,
nga pala yung ano? Mga tamang duda. Ano bang ano yun? Sa heart yun, di ba?
Tamang ano po?
Tamang
Tama
duda.
duda.
Oo.
Correct yung pagdududa nyo.
Tamang duda.
doubting.
Ano yan eh? That's a sign of weak bladder yan.
Weak bladder.
Mm-mm.
Pero we are saying if you can master your emotions, then you will be, you will have peace of mind.
True.
Emotions lang naman eh. Minsan blackmail.
Kasi pag
Siguro kung
nangyari
malakas naman yung lungs, tamang duda eh. Yung corporeal soul niya, tama yung duda.
oo,
Tama
bago
yung
ka
sinasabi.
mo,
May,
bago ka
may correct
magduda,
din.
ano, wag mo masyadong isipin. Kung sa bagay, madali lang sabihin eh.
Yeah.
Yeah, exactly. Yan ang number one, yung mga emotional blackmailing eh.
So, meron po bang
Pero
pagkakaiba
it's so
yung ano?
easy to say, but sometimes kung nandun ka na, mahirap din.
Oo. Isipin mo na lang, pwede kang mapunta sa ICU pag nag-overreact ka.
May positive, meron positive din po yung ano, yung duda. May positive side.
Oo, pero always consider the possibility. Kaya nga duda
Yeah.
you could be wrong.
Yeah.
But be prepared for the worst. Diba? Ganun lang. What if yung duda mo totoo? Diba?
Okay.
Some people cannot accept the fact na totoo pala. Yun, umiinit.
So if you have a self-confidence, then, baka malesen yung mga duda-duda na yan.
Magkakaroon ka ng self-confidence pag inisip mo, pag na-admit ka sa ICU, you need at least 1 million. Yun na lang isipin. And take mo, walang gusto maalaga ng
Ay, nako.
Okay, continue natin, Ma'am Mildred.
Opo.
Continue lang po. Opo.
Continue.
Saya ng topic natin. Goals are
Yeah.
necessary in life. But it is important how we deal with our emotion. Ayun po, dapat talaga i-handle natin yung emotion and attachment. Especially if we don't get what we want.
Exactly.
You should learn how to accept failure. Yun lang yun eh. And wag mo gawing masyadong unrealistic yun.
Balancing.
Balancing, yeah. Kita mo to.
Yes.
Ganda to.
Balancing.
We must have to attend the balancing.
Yeah, in fact, gusto niyo ba si Dr. Gavino magle-lecture on, I was thinking gagawin natin yun sa PAAY kasi it's something very technical and it's exciting. I'll give you the ebook already. Okay. Okay, last slide po, Ma'am Mildred.
We can only try our best and appreciate the driving force to desire to inspire us to work hard to achieve our goals. Yun.
Ano lang, work within your limits. Yun lang naman yun.
Kung anong kaya,
Yun lang.
dun lang tayo mag-na.
At saka be ready to face.
Work on your limit.
Keep trying, diba? So maraming salamat. Mukhang maraming nakaka-relate dito. Okay. Thank you very much. So next we go to tongue diagnosis. Let's call on Ma'am Teresita Sumile. Dump heat. Good afternoon po, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Nasa 69 days na po tayo sa ating tongue diagnosis and at ang topic po natin ngayon ay still the continuation of topic natin yesterday, which is damp heat. Okay?
Damp heat.
Tonight na ba? This afternoon, we have 4 cases.
Okay.
Our first patient is a female, 28 years old. Tongue description, pale red, swollen, slightly wet, with teeth marks. yellow, thick coating with red points at the root and slight notch at the tip. Symptoms are itching and burning in the vagina, swelling and redness in the labia, smelly, soft stools, foul-smelling flatulence, tiredness, and strong inner tension. Western diagnosis is acute candidiasis. Background to disease, condition followed frequent use of antibiotics, and long-standing emotional problems. Chinese diagnoses are spleen qi deficiency with accumulation of dampness, retention of damp heats in the large intestine and genitals, and slight heart blood deficiency. Now let's try to analyze. Spleen qi deficiency with accumulation of dampness in this case is reflected in a pale red tongue body color, swollen tongue body shape with teeth marks, and has slightly wet tongue coating. Patient in this presents symptoms of tiredness. Okay? Retention of damp heats in the large intestine and genitals manifest a yellow, thick coating with red points at the root. Patient in this case presented symptoms of itching and burning in the vagina, swelling and redness of the labia, smelly soft stools, and foul-smelling flatulence resulted from frequent use of antibiotics. Slight heart blood deficiency in this case is presented in a slight notch at the tip of the tongue with symptom of strong inner tension resulted from a background of long-standing emotional problems. Okay? Now let's go to our second patient, male, 33 years old. Tongue description, pale red, wide with curled up edges, small horizontal cracks in the center of the tongue, dry, greasy, thickened, and yellow toward the posterior third. Symptoms are pain upon defecation, frequent dribbling of urine, burning sensation with urination, dizziness, inner tension, insomnia, and itchy skin at night. Western diagnoses are chronic prostatitis and chronic urticaria. Background to disease, alcohol and drug abuse, excessive sexual activity, and long-standing emotional problems. Chinese diagnosis, slight retention of damp heats in the liver and gallbladder with liver qi constraint. Onset of stomach yin deficiency and accumulation of damp heats in the lower burner. Now let's go to analysis. Slight retention of damp heats in the liver and gallbladder with liver qi constraint in this case is shown in a pale red tongue body color with wide curled up edges. Patient presented symptoms of frequent dribbling of urine, burning sensation with urination, dizziness, inner tension, and insomnia resulted from alcohol and drug abuse, as well as long-standing emotional problems. Okay? Onset of stomach yin deficiency in this case is reflected in a small horizontal cracks in the center of the tongue with symptom of itchy skin at night and pain upon defecation. Then accumulation of damp heats in the lower burner in this case is manifested in dry, greasy, thickened, and yellow tongue coating toward the posterior third, resulted from excessive sexual activity. Okay, now let's go to our third patient, a 24-year-old female. Tongue description, red, swollen, red on the right side of the tongue without coating, and dark yellow, greasy coating. Symptoms are paroxysmal one-sided facial pain, especially in the temple and cheek, irritability, facial redness, and insomnia. Western diagnosis is trigeminal neuralgia. Background to disease: alcohol abuse, heroin addiction in the past. Then Chinese diagnosis are accumulation of damp heat in the liver and gallbladder, excessive heat in the gallbladder, and long-standing retention of damp heat. Now let's go to analysis. Accumulation of damp heat in the liver and gallbladder is manifested in a red tongue body color, especially on the sides, with swollen tongue body shape. Patient presented symptoms of irritability and insomnia resulted from alcohol abuse and heroin addiction in the past. Excessive heat in the gallbladder is reflected in a red tongue body color, especially on the right side, without coating, with symptom of paroxysmal one-sided facial pain, especially in the temple and cheek. Okay? Long-standing retention of damp heat is shown in a dark yellow greasy tongue coating with symptom of facial redness. Okay, so now let's go to our fourth patient. A female, 41 years old. Tongue description: reddish, long with curled down tip, reddish center at the tongue, yellow, thick, greasy coating with red swollen papillae at the root. Symptoms are purulent and black.
Yung audio niyo po, Ma'am Teresita. Naku, nawala na.
Hello po, hindi ako maririnig.
Hindi po.
Wala. What happened?
Okay na po, Ma'am Teresita.
Okay na.
Okay na po,
Salamat.
Ma'am Teresita. Okay na po.
Salamat
I can
po.
hear you.
Okay, so saan ba tayo? Okay, repeat ko na lang. Tongue description: reddish, long with curled down tip, reddish center of the tongue, yellow, thick, greasy coating with red swollen papillae at the root. Symptoms are purulent and bloody stools with cramp-like abdominal pains, burning sensation at the anus, thirst, slight fever, weight loss, and tiredness. Western diagnosis is ulcerative colitis. Background to disease: family history of ulcerative colitis, long-standing emotional problems, severe demands at work, caffeine and nicotine abuse. Chinese diagnoses are heat in the heart blood, heat in the stomach, retention of damp heat in the large intestine, transforming into heat toxin. Okay? Now let's go to analysis. Heat in the heart blood is manifested in a reddish tongue body color with long and curled down teeth, resulted from long-standing emotional problems. Heat in the stomach is reflected in a reddish tongue body color, especially at the center, with symptoms of thirst, weight loss, and tiredness, resulted from severe demands at work, caffeine and nicotine abuse, and has a family history of ulcerative colitis. The last is retention of damp heat in the large intestine, transforming into heat toxins, is presented with a yellow, thick, greasy coating with red, swollen papillae at the root, with symptom of slight fever, purulent and bloody stools with cramp-like abdominal pains, and burning sensation at the anus. Okay, yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Do we have any questions? So at least kahit papano, medyo alam nyo na ang itsura ng yung tongue na may damp heat. Okay. Next, we go to diagnosis by interrogation. Let's listen to Ma'am Vina Pascual, straight from Baguio. Good evening, Ma'am Vina.
Good evening po, Doctor. Good evening po sa lahat. At chest and abdomen, day 15 na po tayo. Right lateral lower abdominal area at saka left lateral lower abdominal area. So, continuation po ito kahapon. Yung patient natin kahapon ay 31-year-old woman na she complained of abdominal pain. So, ito yung kanyang diagnosis. In diagnosis, kailangan pong i-differentiate natin yung diagnosis of her present acute problem. Ito yung abdominal pain, dyspareunia, ito yung painful intercourse, and mid-cycle bleeding following the dilatation and curettage from that of her underlying condition. Yung kanyang present problem po of abdominal pain ay maliwanag po na it is due to blood stasis. Na maliwanag naman na ipinapakita sa sharpness ng kanyang sakit and the darkness of the menstrual blood with clots. Kanyang dila po does not show any blood stasis. So hindi po siya purple due to the relative short duration of this problem. Ang kanyang underlying condition is characterized primarily by tatlong problems po. Is una, blood deficiency. Ito ay nagmamanifest sa kanyang pale tongue, floaters, tiredness, tingling, poor memory, and dizziness. Meron pong blood deficiency sa kanyang liver but also of the heart as evidence naman sa kanyang palpitations, breathlessness, at saka yung choppy pulse sa heart position. Number 2 is stomach and spleen deficiency with some affliction of the intestines. Yung kanyang spleen deficiency is manifested po clearly by the swelling of the sides of the tongue. At saka yung tiredness. The stomach deficiency is manifested by the stomach crack and the rootless coating. The fact na yung kanyang rootless coating is on the root of the tongue, pinapakita po doon na meron siyang intestinal pathology. It was only after one pointed this out to her, sinabi po ng author, it was only after I pointed this out to her that she said na she had also just been diagnosed as suffering from intestinal parasites. Number 3 is kidney deficiency. Mamanifest po sa lower back ache, feeling cold, malamig po ang kanyang paa at saka kamay. Meron din siyang occasional tinnitus or tinnitus. As for possible etiology, sabi po ng author, I ventured to say that in my opinion, ang main origin po ng problem was emotional. So, binase down niya po primarily sa choppiness ng kanyang pulso, especially sa heart pulse, and kulang po ng wave, which is usually due to sadness. Sinabi po niya na yung kanyang sadness was the main origin po ng problem. She confirmed this by saying that she had been repeatedly sexually abused nung bata pa siya. And ito marahil yung emotional cause ng kanyang blood deficiency, especially sa kanyang puso. And also of the kidney deficiency, as the sexual abuse was obviously accompanied by yung takot which injured the kidneys. Besides being sexually abused, palagi rin po siyang beaten across the lower back. And I think, sabi po ng author, that rather than riding was the cause for the lower back ache. Ang treatment po nito, one must concentrate sa present acute problem ng blood stasis sa kanyang abdomen with a formula to invigorate blood and eliminate stasis. Ito naman po yung herbal. So, Shenghuata, generating and transforming decoction, which is a formula for abdominal pain from blood stasis after childbirth. Excuse me. Yung kanyang termination po and dilatation and curettage are somewhat energetically equivalent po sa panganganak, without of course the pronounced depression of chi and blood that follows childbirth. Next po ay right lateral lower abdominal area. Yung area na ito po is influenced primarily by large intestine and liver channels and by the penetrating vessel. As a rule of thumb, problems in this area are caused by the gynecological system more often than the large intestine. For example po, in women, yung sakit po sa area na ito is very often due to ovarian cyst. And the most common patterns causing pain in this area are stagnation of chi, distension and or distending pain, pagstasis of blood, fixed po, severe at saka stabbing pain with a feeling of mass. The next ay dampness accompanied by a feeling of heaviness. So mabigat. Cold, matindi po, spastic pain that is elevated pag nilalagyan po ng heat. And the next ay left lateral lower abdominal area. This area is influenced by the large intestine, liver, and spleen channels, and by the penetrating vessel. As a rule of thumb, compared to the right lower abdominal region, yung problems po sa area na ito are often caused by the pathology of large intestine. And the most common patterns causing problems in this area ay parehas po sa right lateral lower abdominal area. Stagnation of chi, distension or nabasa ko na. So itong figure 38 po, it summarizes the most common patterns affecting each area of the chest and abdomen. So dito nakikita natin sa figure, so ito yung main pattern in chest and abdomen by area. So dito, retention of food, stomach and spleen deficiency, phlegm, rebellious chi, stagnation sa kabila naman. Heart blood stasis, lung heat, chi stagnation, and then liver chi stagnation, damp heat, liver or gallbladder, and then liver chi stagnation, liver blood stasis, damp heat, liver and gallbladder. So dito sa banda baba, so merong cold in the stomach, stomach heat, stomachian deficiency, retention of food, damp heat in the stomach, and cold or chi stagnation, blood stasis, retention of food. And then dito sa baba, chi stagnation, blood stasis, dampness, o kaya chi stagnation, blood stasis, dampness, at saka cold. So, yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina.
Thank you very much po.
Okay, so I hope that helped. Next, we proceed now to pulse diagnosis. And let's welcome Sir Dino, straight from Legazpi.
Wow, Legazpi.
Oh, Legazpi pa yan. So, wait lang po ah. Nako, ano ba nangyari? Wait lang. Okay. Sorry for the delay.
Good afternoon, Doc. Good afternoon, classmates. Okay, today ang topic natin is Soggy, weak floating pulse. So, Soggy is also called weak floating. Pulse can only be felt at the superficial level, and it is relatively floating, but weak and soft like wet cotton wool or wet bread. So, para siyang basaan na cotton. And superficial po siya mararamdaman. It disappears when a strong pressure is called ru, which means sudden, but also ruan, which means soft. Sabi niya sa previous book, yung pulse quality is weak floating, which describes well its characteristic of being weak and soft, but also slightly floating. So, yun ang Soggy. Sa clinical significance, ito is for chronic chi deficiency with retention of dampness. It is relatively common pulse quality in chronic condition with dampness, such as post-viral fatigue syndrome. The saggy pulse also indicates stomach chi deficiency. Sa common condition presenting with the saggy pulse are digestive disorders, chronic fatigue syndrome, merong asthma, nocturnal emissions, and diarrhea. So, saggy pulse. So, sa summary, chronic chi deficiency with dampness. Sa combination, we have saggy fine, indicates severe spleen chi deficiency with chronic retention of dampness. Pag saggy chappy naman, indicates exhaustion of blood. Pag saggy floating, denotes deficiency of defensive chi. Pag saggy wiry naman, denotes dampness with liver chi stagnation. Sa saggy rapid, indicates damp heat. So, differentiation of similar pulses, yung empty, the empty pulse feels soft but relatively big and floating. Compared sa saggy pulse, thinner siya, weaker, softer, and less floating. So, ang empty, mas sa ibabaw siya mararamdaman kumpara sa saggy. Sa weak naman, the weak pulse is soft and can be felt only at the deep level. Whereas yung saggy pulse is also soft but can be felt at the superficial level compared dito sa weak, which is mas malalim po. Sa clinical significance in its position, front position, decline of yang qi with incessant sweating. Sa middle position, we have deficiency of central qi. Sa rear position, injury of essence and blood, deficient cold in the lower burner, to bring about an improvement warm and tonify the true yin. So hanggang doon lang po. Thank you for listening.
Thank you very much, Sir Dino. Questions? Okay, master na natin yung pulse. From pulse diagnosis, we go to differential diagnosis. And let's listen to Ma'am Needs You for heart yin deficiency. Good evening, Ma'am Needs.
Good evening, Doc Hector. Good evening, everyone. How's my audio, Doc?
Medyo okay na po.
Medyo mahina kasi yung internet. Sana
Oo nga,
wala.
sige lang, okay lang. Dinig naman, at least may boses.
Opo. Lakas ko na lang. Thank you, Doc. So, today, our topic is heart yin deficiency in our 155 TCM foundations, okay? So, heart yin deficiency is one of many possible underlying factors from a TCM perspective for health issues katulad ng amnesia, angina, arrhythmia, or palpitations, astigmatism, atrial fibrillation, bedwetting, bradycardia or low heart rate, coronary artery disease, depression, diabetes type 2, heat stroke, hyperthyroidism, myocardial infarction, palpitations, shattering, and or systemic lupus erythematosus or SLE. Okay. This pattern often derives from heart blood deficiency. Both patterns share similar symptoms such as palpitations, insomnia, disturbed sleep, easily scared, madaling matakot, mahina yung memorya, restlessness, and anxiety. Okay? Blood is a type of yin element. Alam na natin yon. If heart blood get insufficient over a long period of time without being treated, it can eventually develop to the yin deficiency. Therefore, middle-aged or elderly patients have more tendency to have heart yin deficiency, while heart blood deficiency is more seen among younger patients, especially young women. Okay? Mas maano pala yung heart blood sa mga bata. Okay. Heart yin deficiency may also evolve to empty heat pattern with typical manifestations of malar flush, five palm heat, and feeling of heat, especially in the afternoon or evening. Okay. So, etiology, long-standing anxiety, worry or sadness, excessive mental and physical activity, exterior heat consuming in of the body, chronic illnesses, and blood loss. Okay? Underlying or accompanying pathology, kidney deficiency, heart chi deficiency, and heart blood deficiency. Okay? So, ano ang dahilan ng heart chi deficiency? History of emotional problems. For example, sadness, fear, worry, or anxiety for years on end. Napakatagal. So, sa menopause, this occurs when a woman's body stops making so much blood. This can cause blood deficiency. Always being active or on the go or overwork, it seems okay kapag ikaw yon. But consider, it's hard to be objective. In Chinese medicine, it gradually drains you, weakening your heart blood, then leading to heart yin deficiency. This on-the-go personality is often anxious and unable to let matters rest. Parating habol ng habol. Everything must be just right before they relax. Hindi masyadong nagre-relax. Of course, perfection never actually happens because they always think of something else that needs to be done. Parang ako yan. Fluids through the skin. If your body can't regenerate these fluids, you may get yin deficiency which could lead on to your heart yin deficiency. Okay, ng tubig. Old people who have experienced any of the above causes, so as people age, their bodies become less efficient. For example, their stomach yang and spleen chi reduce, leading to poorer digestion. So there is a tendency to blood deficiency which can lead to heart blood deficiency and then heart yin deficiency. Sunod-sunod na lang. After severe overheating, which is termed an attack by exterior heat, such as might occur in a fever from infection or in a very hot country when your body lacks the means to cool itself. Sobrang init. The yin chi and fluids of your body are consumed by yang heat and you get dried out, natutuyot. Old people and very young children are more susceptible to this. For the same reason, loss of fluids could cause this. This might happen when you get edema for some reason and take diuretics to clear it before your body really catches up. Another way might be through heavy loss of lymph. Okay? Physical symptoms common to heart yin deficiency ay yan, yung palpitations. The heart suddenly races, parang in love parate, causing great anxiety. Actually, this may not be as serious as it seems if it occurs only occasionally in healthy people. However, if frequent, it becomes debilitating. Okay? Insomnia. Apart from difficulty getting to sleep, you may wake up during the night. Sometimes from night sweats. Sleep is disturbed by many dreams. Okay? Dizziness. Sometimes with very short transient episodes or of painting or mental blackouts, as if you can't remember what happened. For example, you walk along a short corridor and can't remember how you reached the end of it. Alternatively, you faint but don't lose consciousness. Okay? Heat. Not so much sensation of real heat radiating from you, more feeling somewhat hot and bothered. Later in the day, you feel warmer and your tongue itches or burns. Your ears feels hot. Actually, that is more due to kidney deficiency. But it often contributes to heart yin deficiency symptoms. Okay? Tandaan nyo yun. Warm hands and feet. Specifically, it is more likely to be your palms and soles that feel warm. And this increases through the day, occurring more in the evening by when your palms may also be sweating. In the morning, you could have even cold hands, okay? Warm chest. As with your palms and soles, the center of your chest may feel warm, more so towards in the evening, okay? Pain. In itself, this syndrome doesn't have much pain, more uneasiness and heat, but sometimes there is pain occurring later in the day or evening and affecting the palms, eyes, or the tongue, okay? Ang pulse ng heart deficiency, fine and rapid or floating, empty and rapid. Ang tongue ng patients, red, no coating. Swollen, red, then tip. Okay, namamaga, tas medyo mapula yung tip. Deep midline crack, reaching the tip. Okay? Treatment principle, enrich heart and kidney, calm the shen. Acupuncture treatment, heart 7, supplements heart, blood, and yin. Ren 14, calms the spirit. Ren 4, supplements the yin, clears empty heat. Kidney 6, supplements kidney yin, promotes sleep. Precardium 6, calms the spirit. Ren 15, calms the shen. Spleen 6, supplements yin, calms the shen. Okay? Ang needle na technique ay with supplementation or tonifying. Okay? Thank you very much. I hope you understand. Thank you po,
Arigato.
Doc.
Arigato.
Arigato. Okay. Thank you very much, Ma'am Needs.
Arigatou gozaimasu.
Yeah. Ang dami pong may heart yin deficiency, lalo na sa medyo hindi na masyadong bata. Okay?
Aray ko po.
Aray ko po.
Okay, from heart yin deficiency, tuloy po tayo. Punta naman tayo sa edema, yung nagmamanas-manas na. And let's listen again to Sir Dino. Good evening, Sir Dino, ulit.
Good evening, Doc. Good evening, classmates. Okay, topic natin is chronic edema. This is the case of Mr. Yang, 57 years old. So, meron siyang first consultation, May 14. Ang complaint niya, meron siyang lower limb edema and feet numbness for over half a year. Sa history, medical history, the patient suffered from lower limb edema and feet numbness for over half a year na nag-worsen when standing for long period of time. He was diagnosed with weakness of the kidney and was hospitalized without any curative effect. Sa May 9, he was hospitalized again due to relapse of lower limb edema. He was treated by prednisone, albumin, and so on. He was discharged after the symptoms resolved. However, the edema occurred again 5 days later and came for treatment. The patient had a history of dilated cardiopathy and cardiac function grade 3. So he took digoxin and cordarone daily. Ang presenting symptoms niya, meron siyang mental fatigue, general edema, especially in the lower limb, feet numbness, burning heat sensation in the left sole, dry mouth, scanty and clear urine, pale dark tongue with teeth marks with a white tongue coating and a deep and thin pulse. Sa physical examination, pitting edema in the waist, sa back, meron din, and in the lower limb below the knees. Dilated heart edge to the left. Regular heartbeat, 64 beats per minute. Urine routine test. Ang protein niya, +4. UPQ, 7.9 grams every 24 hours. Yung blood test niya, yung total protein is 32 grams per liter. Yung albumin niya is 20 grams per liter. Yung BUN, 9.2. Yung creatinine, 161. So, may elevated. Pattern differentiation nephrotic syndrome pertains to edema in the Chinese medicine, which has a close relationship with the spleen, kidney, lung, and sanjiao. The spleen is the earth organ and the foundation of acquired constitution, while the kidney governs the Mingmen fire and is the foundation of congenital constitution. The transformation and transportation function of the spleen depend on the warmth of kidney yang, and in turn the kidney essence lies on a constant replenishment of food essence transformed and transported by the spleen. So there is nagdi-depend yung spleen sa kidney and yung kidney naman sa spleen. Thus, these two organs supplement and promote each other. If the spleen yang is insufficient with weak function of transformation and transportation, then the food essence production will fall short and it inevitably lead to kidney essence insufficiency and failure of the spleen to control water manifesting in general edema, especially in severe lower limbs. Yung feet numbness and burning sensation in the left sole are signs of obstruction due to stasis. The symptoms of dry mouth, a pale, dark tongue with teeth marks and a white tongue coating, and deep and thin pulse are signs of obstruction impairing the passage of body fluid. In this case, the disease location is in the spleen and kidney with a root deficiency and branch excess. So, combination of deficiency and excess. Ang diagnosis niya is edema due to spleen and kidney deficiency with stasis impairing the body fluid passageway. Sa Western medicine diagnosis, nephrotic edema. Sa treatment, in this case, the pathomechanism mainly lies in dampness retention due to spleen deficiency causing the stasis obstruction impairing the body fluid passageway. As a result, it manifests as general edema, especially severe in the lower limbs, with numbness and burning sensation on the left sole. So, treatment principles, we have to fortify the spleen to promote urination. Warm qi to drain dampness, dispel stasis, and nourish yin. So may mga formula. So hanggang doon lang po. Thank you for listening.
Thank you very much, Sir Dino. So I hope you learned something there. That's very, very common po, no? At least kahit paano may magagawa po tayo. Okay, after wala po si Sir Alvin Palabay, so we were going to take over. The topic is signs and symptoms, and we shall talk about the pale nose and the yellow nose. Okay. So the first consideration, pag yung ilong ng isang tao ay maputla, you would immediately think of stomach and spleen yang deficiency with empty cold, maputla eh. So there will also be discomfort or dull pain in the epigastrium that is better after eating. So pagkakain niya nawawala, no? And better pag nag-apply ka ng pressure or massage. No appetite, preference for warm drinks and foods, vomiting of clear fluid, no thirst, cold and weaklings, tiredness, pale complexion, loose stools, feeling cold, cold limbs. So when you look at the tongue, it's pale, obviously, and wet. And then the pulse is deep, weak, and slow. Another consideration would be among women, okay? Yung mga mapuputla ang ilong. Pale bridge of the nose, okay? Tinan-tinan yung mga ilong nyo. Dull pale ang face. Dizziness, blurred vision, floaters, numbness or tingling of the limbs, scanty menses. So the tongue is pale, pulse is choppy or fine. And the third one, pag may nakita kayong pale ang nose and swollen ang tip, okay, hindi lang siya pale, kundi swollen. Swollen face, greasy skin. So kung nakikita niyo yung icon dyan, nakikita niyo medyo maedad na, no? Yun. Abdominal fullness and distension, nausea, vomiting, or watery fluids. Dry mouth without desire to drink. Shortness of breath. Dizziness, feeling of oppression of the chest, swelling of the limbs, expectoration of thin watery sputum, inability to lie down, kasi pag nakahiga siya lalong para siyang nalulunod, parang masyadong mabigat. Swollen tongue, sticky coating. So this is very, very characteristic. So when you look at when you feel the pulse, it's deep, wiry, or deep, slippery. Now let's go to yellow nose. First thing that you will have to consider is damp heat in the spleen. So bright yellow nose, if heat predominates, pero pag yung nose niya is dull and yellow, dampness predominates. Okay, so my difference po, bright yellow, dull yellow. Greasy skin, fullness of the epigastrium, epigastric of abdominal pain, sticky taste. Thirst, no desire to drink, poor appetite, feeling of heaviness, thirst, nausea, vomiting, loose stools with offensive odor. Remember, pag may amoy po yung ating stools, that's very damp heat, no? Feeling of heat, scanty dark urine, headache with feeling of heaviness of the head, dull yellow complexion, bitter taste, red tongue with sticky yellow coating, slippery rapid pulse. Another consideration would be chronic spleen deficiency with retention of dampness. So dull yellow po ito. So this is very deficiency. Dull pale face, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale or sallow complexion, weakness of the limbs, loose stool, slight depression, tendency to obesity, abdominal fullness, feeling of heaviness, sticky taste, poor digestion. Then you have undigested food in the stools, nausea, dull frontal headache, excessive vaginal discharge, and the tongue is pale with sticky coating. The pulse is soggy. Third consideration for yellow nose, liver blood stasis. Okay, so when you look at the bridge of the nose, it's dull and dark yellow. Dark complexion, remember, stasis po ito, blood stasis. So medyo iba na, medyo biglang nag-iba yung complexion, medyo dumilim, no? That's very blood stasis. Kaya tingnan niyo yung mga friends niyo sa FB. Alam niyo kung sino yung may blood stasis. Hypochondrial pain, abdominal pain, painful periods, menstrual. Okay, so sa mga babae naman, you would always ask, anong kulay ng blood, ng menstrual blood mo? Is it clotted? Is it dark blood? Dark red. Masses in the abdomen, purple nails and lips. So titingnan mo yung lips, no? Baka hindi talaga, although uso na ngayon yung mga lipstick na purple, pero hindi naman pala lipstick yon. And tingnan nyo yung tongue, purple na purple. The pulse is wiry or firm. The fourth consideration for a yellow nose is spleen heat. So this time, pag heat, hindi siya dull, bright yellow, and then dry. Burning, epigastric and abdominal pain, excessive hunger, red tip of the nose, dry lips. Actually, the tip of the nose is very, it actually tells a lot about the spleen, no? Dry lips. So tingnan niyo yung dulo ng ilong nyo, no? Okay. Dry lips, mouth ulcers, thirst, dry stools, feeling of heat, scanty dark urine, yellow complexion. The tongue is obviously red with dry yellow coating, and the pulse is overflowing and rapid. And the last one, may edad na naman yung nakikita niyong icon, no? Dull yellow, so dull. Ibig sabihin, yung phlegm niya dahil po sa deficiency. Dull yellow, it's a deficiency condition. Swollen. Hindi lang siya dull yellow, swollen pa. So biglang namaga yung ilong. Abdominal fullness and distension, nausea, vomiting, watery fluids, dry mouth without desire to drink, shortness of breath, dizziness, feeling of oppression of the chest, swelling of the limbs, and then nag-expectorate po siya ng thin watery sputum. Inability to lie down again, swollen tongue with sticky coating, the pulse is deep wiry or deep slippery. Okay, so we're done. Are there any questions? I hope every time you see a patient who comes to you with the pale nose or yellow nose, you would know what to consider. For the last topic, unfortunately, Sir Aldrin cannot make it, so we have asked again the kindness of Ma'am Teresita Sumile to do the honors. And we will start on a new topic. I like this topic, anxiety. Good evening, Ma'am Teresita.
Good evening po, Dr. Hector and classmates. We have a new topic tonight, which is anxiety. This is all about Western and Chinese medicine concepts. Anxiety is a normal reaction to stress. In general, it helps one to cope. But when anxiety becomes an excessive, irrational dread of everyday situations, it has become a disabling disorder. Okay? Anxiety in Western medicine is anxiety in Western medicine. The anxiety disorders discussed in Western medicine are as follows: generalized anxiety disorder, panic disorder, obsessive compulsive disorder, post-traumatic stress disorder, social phobia or social anxiety disorder, and specific phobias. Each anxiety disorder has its own distinct features, but they are all bound together by the common theme of excessive, irrational fear, worry, and dread. A chronic state of anxiety is usually called generalized anxiety disorder. The essential characteristic of generalized anxiety disorder is an excessive, uncontrollable worry about everyday things. This constant worry affects daily functioning and can cause physical symptoms. Generalized anxiety disorder can occur with other anxiety disorders, depressive disorders, or substance abuse. Generalized anxiety disorder is often difficult to diagnose because it lacks some of the dramatic symptoms such as unprovoked panic attacks that are seen when with other anxiety disorders. For a diagnosis to be made, worry must be present more days than not for at least 6 months. Okay? Physical symptoms may include muscle tension, sweating, nausea, cold, clammy hands, difficulty in swallowing, jumpiness, gastrointestinal discomfort or diarrhea, irritability, feeling on edge, tiredness, and insomnia. A panic attack is defined as the abrupt onset of an episode of intense fear or discomfort, which peaks on approximately 10 minutes and includes at least 4 of the following symptoms: a feeling of imminent danger or doom, the need to escape, palpitations, sweating, trembling, shortness of breath or a smothering feeling, a feeling of choking, chest pain or discomfort, nausea or abdominal discomfort, dizziness or lightheadedness, a sense of things being unreal, depersonalization, the fear of losing control or going crazy, a fear of dying, tingling sensations, and chills or hot flashes. Panic disorder is diagnosed when individual suffers at least 2 unexpected panic attacks followed by at least 1 month of concern over having another attack. Sufferers are also prone to situationally predisposed attacks. The frequency varies from person to person. An individual might suffer from repeated attacks for weeks, while another will have short bursts of very severe attacks. Okay? Panic disorder affects about 2.4 million adult Americans, and is twice as common in women as in men. Now let's go to anxiety in Chinese medicine. Anxiety is a modern term that does not have an exact equivalent in Chinese medicine. The author discussed the view of anxiety in Chinese medicine according to the following topics. Chinese medicine entities corresponding to anxiety. Second, rebellious qi of the penetrating vessel. Then the third, palpitations in Chinese diagnosis. And the last one is difference between mind unsettled and mind obstructed in anxiety. Okay. Chinese disease entities corresponding to anxiety. There is no Chinese medicine term that corresponds exactly to what we call anxiety, but several ancient Chinese disease entities closely resemble anxiety. The two main disease entities that correspond to anxiety are 1. Fear and palpitations or Jingji. Second, panic throbbing or Zeng Chong. Both these conditions involve a state of fear, worry, and anxiety. The first with palpitations and the second with a throbbing sensation in the chest, okay? And below the umbilicus. Fear and palpitations is usually caused by external events such as fright and shock, and it comes and goes. It is more frequently of a full nature. Panic throbbing is not caused by external events and it is continuous. This condition is usually of an empty nature and is more serious than the first. In chronic cases, fear and palpitations may turn into panic throbbing. In severe cases, panic throbbing may correspond to panic attacks. Despite the name fear and palpitations, such states of fear and anxiety may occur without palpitations. Okay? Now, in both fear and palpitations and panic throbbing, there is blood deficiency. Fear and palpitations come in bouts. Panic throbbing is constant. Panic throbbing is due to worry and pensiveness agitating within, causing a deficiency in phlegm heat. Okay? In panic throbbing, the heart is shaking in the chest. The patient feels fear and anxiety. There is yin deficiency and exhaustion. There is yin deficiency below, so that the gathering qi or zong qi has no root, and qi cannot return to its origin. For this reason, there is shaking or shrugging of the chest above and also shrugging of the sides of the umbilicus. Okay? Now let's go to the summary of Chinese disease entities corresponding to anxiety. First one is fear and palpitations or Jingji. Second is panic throbbing or Zeng Chong. And the third one is rebellious qi of the penetrating vessel or Li Qi. Yan lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. I hope everybody learned a lot from this session. Any questions before we close? Okay, I know you're all excited para mamaya. Tomorrow we will have no Zoom. It's a Wednesday, so we will see you again on Thursday po. So good evening, everyone.
Good evening. Good evening.
See you later. Please try to log
Good
on.
evening. See you later.
Good evening po. Bye-bye.
Good night.
I'll end na. Bye-bye.